Stop. Right now. Whatever you're doing, stop. Hold up your hands in front of your face. Look at your nails. Not the color. Not whether they need trimming. I want you to look at the shape, the texture, the lines, the color underneath, because what I'm about to show you in the next 30 minutes could, and I don't say this lightly, save your life. I've spent weeks researching clinical literature, physician examination guides, and documented case studies, and what I found shocked me. There are 7 changes happening on your nails right now that doctors are trained to spot in seconds during a physical exam. Changes that are directly linked to heart disease, lung cancer, liver failure, melanoma, and autoimmune destruction. And most people, maybe you, have been walking around with these signs for months without knowing. By the end of this video, you will never look at your hands the same way again. Stay with me, because sign number 7, the one I'm saving for last, is the one that has sent people to the hospital after watching videos exactly like this one. Let's begin. But really quick before we dive in, if you're new here, welcome. This channel is all about giving you honest, practical health information that actually helps you make better decisions for yourself and your family. We are on a mission to reach 1,000 subscribers, and every single person who joins this community genuinely matters to us. So, if you find today's video helpful, please hit that subscribe button and ring the notification bell. It costs you nothing, and it means the absolute world to us. Okay, now let's really get into it. Sign number 1, nail clubbing, the silent signal of lung cancer and heart failure. Sign number 1, and I want you to do this test right now as I explain it. Take both of your index fingers and press them together, nail to nail, like a mirror image. Look at the space between them. You should see a small diamond-shaped gap where the nails meet at the base, a little window of light between them. That gap is called the Schamroth window, named after Dr. Leo Schamroth, a cardiologist who noticed the absence of this gap in his own fingers when he developed infective endocarditis, an infection of the heart valves. If that gap is gone, if your fingertips press flat against each other with no space, that is nail clubbing. And nail clubbing is one of the most significant physical examination findings in all of medicine. Here's what it means. When your lungs aren't working properly, or when your heart isn't pumping efficiently, the oxygen saturation in your blood drops chronically. Your body responds by sending extra blood flow and growth factors to the fingertips, causing the soft tissue to thicken and the nail to curve downward over the enlarged tip. It happens slowly, over months, over years, so slowly that most people never notice it happening to themselves. Conditions associated with nail clubbing. Lung cancer. Clubbing is present in up to 35% of non-small cell lung cancer patients at diagnosis. COPD and emphysema pulmonary fibrosis. Scarring of the lungs. Congenital heart disease. Congestive heart failure. Infective endocarditis. Infection of heart valves. Inflammatory bowel disease. Crohn's disease and ulcerative colitis, liver cirrhosis, celiac disease. Here's what makes this terrifying. Clubbing is painless. Completely painless. There's no warning shot. You don't feel it. You just slowly lose that diamond gap while your lungs are quietly losing function. I want to be clear. Some people have mild, naturally curved nails that are not clubbing. The key indicator is change over time and the loss of the Schamroth window. Do the test now. If that gap is gone, please see your doctor this week, not next month. This week. Sign number 2, white or pale nails. Your liver is sending you a distress signal. Look at your nails again. What color are they underneath? In the nail bed? Healthy nails are pink, a consistent, warm pink from base to tip, reflecting the oxygenated blood flowing just beneath the surface. Now, are yours pale? Washed out, almost white? Because if they are, your body may be telling you something about your liver, your heart, or your blood, and it's not good. Let me tell you about Terry's nails. In 1954, Dr. Richard Terry described a specific nail pattern he kept seeing in patients with liver cirrhosis. The nail turns almost entirely white, chalky, opaque, with only a narrow strip of pink or reddish-brown at the very tip. The lunula, that little white half-moon at the base, disappears completely. Terry's nails are now clinically associated with liver cirrhosis, found in up to 80% of patients' congestive heart failure, type 2 diabetes, chronic kidney failure, hyperthyroidism. The mechanism? When the liver is failing, protein levels in the blood, particularly albumin, drop dramatically. This changes blood flow to the nail bed, reduces the visibility of underlying vessels, and turns the nail white. But Terry's nails aren't the only white nail pattern to watch for. Half and half nails, also called Lindsay's nails, show the nail split into two distinct zones, white on the bottom half, pink or reddish-brown on the top half. This pattern is strongly associated with chronic kidney disease and renal failure. Murka's lines are pairs of white horizontal bands running parallel across the nail, not ridges, but color changes in the nail bed itself. They're linked to low albumin levels, nephrotic syndrome, and chemotherapy. And simple pale nails across the board, not white, just drained of color, are one of the most consistent signs of severe iron deficiency anemia. Your blood simply doesn't have enough hemoglobin to color your nail beds pink. Here's your check. Press on your thumbnail for 2 seconds and release. Your nail bed should turn white briefly, then flush pink within 1 to 2 seconds. If the return to pink is slow, or if the nail was already pale before you pressed, that's a sign of poor circulation or low hemoglobin. Simple test. Do it right now. Sign number 3, yellow nails. When it's not just old Polish, it's your lungs. Let me guess. You've seen yellow nails before and assumed it was nail polish staining. Old gel. UV damage. Maybe, but maybe not, because yellow nail syndrome is a real, documented medical condition, and it is far more serious than cosmetic discoloration. Yellow nail syndrome was first described in 1964 and is defined by a clinical triad. 3 things happening together: yellow-green, thickened, slow-growing nails that may detach from the nail bed lymphedema, swelling of the limbs due to lymphatic system failure, respiratory disease, chronic lung conditions, including pleural effusion, fluid around the lungs, bronchiectasis, or chronic bronchitis. You don't need all 3 for concern. Even isolated yellow nails with respiratory symptoms warrant investigation. Associated conditions include bronchiectasis, permanent widening of the airways, chronic sinusitis, pleural effusion, lymphedema, rheumatoid arthritis, immunodeficiency disorders, certain cancers, particularly lymphoma. The nails in yellow nail syndrome have a very specific look. They're not just yellow. They're thick, slow-growing, sometimes curved, with a yellow-green tint and a loss of the cuticle. They may lift off the nail bed, a condition called onycholysis. Now, fungal nail infections also cause yellow, thick nails, and that's far more common. But fungal infections typically affect 1 or 2 nails, start at the tip, and don't come with respiratory symptoms. If multiple nails are affected, they appeared without trauma, and you have any chronic respiratory issues, shortness of breath, persistent cough, recurring chest infections, bring both to your doctor together. That combination is the flag. Sign 4. Spoon nails, koilonychia. Iron is draining out of your body. This next one is dramatic when it's fully developed, and subtle when it's just beginning. I want you to look at the shape of your nails from the side. Do they curve upward at the edges? Almost like a shallow bowl or a spoon. That is koilonychia, spoon nails, and it is a textbook sign of one of the most widespread and underdiagnosed conditions on the planet. In healthy nails, the surface curves gently downward, convex, like the outside of a spoon. In koilonychia, that curve reverses. The nail flattens first, then scoops upward, concave, like the inside of a spoon. In advanced cases, you can literally place a drop of water on the nail, and it won't roll off. The classic cause is iron deficiency anemia, and I mean severe iron deficiency, the kind that happens when your body has been running on empty for months or years. Iron is essential for nail keratin synthesis. When iron drops to critically low levels, the nail loses structural integrity and begins to deform. But koilonychia is also associated with hemochromatosis, iron overload disorder, hypothyroidism, Raynaud's disease, a circulatory disorder, coronary heart disease, Plummer-Vinson syndrome, a rare condition linking iron deficiency to difficulty swallowing and increased esophageal cancer risk. Here's the part that gets me. Iron deficiency affects an estimated 2 billion people worldwide. It is the single most common nutritional deficiency on Earth. And billions of people are walking around with fatigue, brain fog, hair loss, brittle nails, and chalking it up to stress, aging, or being busy. A single blood test, a complete blood count with ferritin, can diagnose this in 24 hours. If your nails are spoon-shaped, get that test. It costs almost nothing, and it could explain years of symptoms you've been living with. Sign number 5, dark streaks under the nail. The melanoma that kills because people think it's a bruise. I need you to pay very close attention to this one. Look under your nails, all of them, thumbs especially. Is there a dark streak, brown, black, or dark red, running vertically from the base of your nail toward the tip? If yes, when did it appear? Did you injure that finger? Did it happen gradually, without any trauma? Because this could be subungual melanoma, and subungual melanoma kills people not because it's untreatable, but because it gets ignored. Subungual melanoma is a form of acral lentiginous melanoma, a skin cancer that develops in the nail matrix and presents as a dark pigmented streak called melanonychia. It accounts for only about 1 or 3% of all melanoma cases in white populations, but up to 30–40% of melanoma cases in darker-skinned populations, including Black, Asian, and Hispanic individuals. And yet it is consistently missed by patients and sometimes by doctors because it looks exactly like a bruise under the nail. Bob Marley, one of the most iconic musicians who ever lived, he died at 36 years old from melanoma that originated under his toenail. He had noticed the dark streak. He was told it was a bruise from a football injury. By the time it was correctly diagnosed, it had spread to his brain, lungs, and liver. I'm not telling you that to frighten you with a celebrity story. I'm telling you because that story repeats itself in ordinary people in clinics around the world, every single year. If you have a dark streak under any nail that appeared without injury, that hasn't grown out over 6 to 8 weeks, or that has a blurry border, see a dermatologist this week. Not a GP, a dermatologist. Early stage subungual melanoma is treatable. Late stage is not. Sign number 6. Nail pitting your immune system is eating itself. Tilt your nails toward the light right now. Look at the surface of the nail plate itself, not underneath, not the edges, the surface. Do you see tiny dents? Little ice pick holes dotting the surface like the skin of an orange? That is nail pitting, and it is one of the earliest and most overlooked signs of autoimmune disease. Nail pitting occurs when clusters of defective cells in the nail matrix produce areas of weak parakeratotic nail that flake off the surface, leaving small depressions behind. It is most strongly associated with psoriasis, a chronic autoimmune condition affecting the skin, joints, and nails. Here's the critical fact. Nail pitting can appear years before skin psoriasis develops. In some patients, the nails are the only visible sign of the disease for a decade. And this matters because psoriasis isn't just a skin condition. Left untreated, it significantly increases the risk of psoriatic arthritis, joint destruction that can be permanently disabling, cardiovascular disease, metabolic syndrome, depression, and anxiety. Type 2 diabetes. Nail pitting is also associated with alopecia areata, autoimmune hair loss, reactive arthritis, sarcoidosis, eczema. The number of pits matters. Occasional shallow pits can be normal, but multiple deep pits across several nails, combined with any skin changes, scalp flaking, or joint stiffness in the morning, that's a pattern that a rheumatologist needs to see. Psoriatic arthritis affects up to 30% of people with psoriasis. Early treatment, before joint damage occurs, is the difference between a manageable condition and a disabling one. If your nails are pitted and your joints ache in the morning, don't let anyone tell you it's just aging. push for a rheumatology referral. Sign number 7, Bow's lines. Your nails recorded the worst moment of your health, like a black box. This is the one I promised you at the beginning, the one that sends people to hospitals after they see videos like this. Look at your nails. Look across them, horizontally. Do you see a deep groove? A dent? A ridge that runs straight across the nail from one side to the other? Not along the nail, across it. If you see that on multiple nails, that is a Bow's line, and it is one of the most remarkable clinical findings in all of physical medicine. Here's what makes Bow's lines extraordinary. Your nail grows continuously at approximately 3 millimeters per month. When your body undergoes a severe systemic shock, a major illness, a metabolic crisis, a cardiovascular event, nail growth temporarily stops, the matrix shuts down, and when it restarts, a horizontal groove is left behind, a permanent record of that shutdown event, embedded in keratin. As the nail grows forward over the following weeks and months, that groove moves toward the tip, like a timestamp moving through time. The math is precise. Measure the distance from the base of your nail to the groove. Divide by 3 mm. That's approximately how many months ago the event occurred. Bow's lines are caused by heart attack, myocardial infarction, severe pneumonia or systemic infection, uncontrolled diabetes, particularly diabetic ketoacidosis, major surgery or severe trauma chemotherapy, severe malnutrition or crash dieting, high fever illnesses, COVID-19, typhoid, scarlet fever, hypothyroidism, Raynaud's disease, major psychological trauma. In rare cases, here are why people ignore this, and why ignoring it is a mistake. By the time you see the Bow's line, you've already survived whatever caused it. You got through the pneumonia, you recovered from the surgery, you made it through the worst of COVID, and so the groove feels like old news. But here's the critical question: can you explain it? If you look at your nail right now and see a deep horizontal groove, and you can point to a specific illness or event 2, 3, 4 months ago that would explain it, that's your answer. Your body recorded a rough patch. You survived. You're okay. But if you look at your nail and see that groove, and you can't explain it, you don't remember being severely ill, you haven't had surgery, you haven't had a known health crisis, that unexplained Bow's line is a reason to see your doctor. Because something happened to your body severe enough to shut down nail growth, and you don't know what it was. That is worth investigating. Your nails kept the receipt. Don't throw it away. Let's bring it all together. 7 signs. Check them all right now. Sign 1. Clubbing. Do the Schamroth test. Is the diamond gap gone? Lung or heart disease. Sign 2. White or pale nails. Are your nail beds chalky white or washed out? Liver disease, kidney failure, anemia. Sign 3. Yellow nails, multiple yellow, thick, slow-growing nails. Lung disease, lymphedema. Sign 4. Spoon nails. Do your nails curve upward like a bowl? Iron deficiency, thyroid disease. Sign 5. Dark streaks. A vertical dark streak with no injury history? Possible melanoma. See a dermatologist now. Sign 6. Pitting. Ice pick holes across the nail surface. Psoriasis, autoimmune disease. Sign 7. Bow's lines. Deep horizontal groove across multiple nails. Your body recorded a serious systemic event. Look, I know this was a lot, and I know some of what you just heard might be sitting with you in a heavy way right now. That's okay. That feeling is called paying attention. And paying attention is the first step toward catching something before it catches you. Most of you will check your nails, find nothing concerning, and go about your day with a little more awareness than before. And that's a win. But for some of you, a few watching right now, something in this video matched something on your hand, and that quiet recognition is exactly why this video exists. Don't Google yourself into a diagnosis. Don't panic. Just book an appointment. Mention what you saw. Show your doctor your nails. It might be nothing. It might be everything. Your body has been talking. Now you know how to listen. If this video helped you, share it with someone you love. It takes 5 seconds, and it might matter more than you know. I'll see you in the next one.